our genetics haven't changed that much in 100 years, right? That's not how genetics works. So maybe there's a little bit of change, but not much. What has changed is our environment. Whatever it is that we are doing in society, we are doing one or many, probably many things that are contributing to what we call autism. That is creating this significant increase in cases. Now, were there more cases 100 years ago? Probably. But I don't think that would account for 1 in 25,000 to 1 in 22. That's a huge difference.
So I've definitely been in my feels lately, and it makes me really happy that I have a therapist that I know and love and trust, because I just can't imagine going through life without a therapist at this point. You actually had me laughing so hard, Casey. I was listening to one of our episodes and you reference your therapy.
Therapy, it's the plural of therapist. I made it up and it sticks. So I have 3 currently.
Yeah, I mean, there's no shame in our game. We think that therapy and mental health services are so important. So grateful that BetterHelp is a sponsor of the show. We want to make sure that you and our audience has access to it as well. All you have to do is go to betterhelp.com/motherup, and you can get access to licensed therapists who are trained to listen and give you that helpful, unbiased advice. I mean, I know that you have us, but unfortunately we can't directly talk to you through the podcast, but you go to their site, you answer a few questions, and they match you to somebody who has years of experience, who is helping people just like you in a way that fits you. So whether it's somebody that is faith-based, or if you prefer a certain gender, I mean, they really get specific in how they can select a therapist for you. You do it all from your phone or computer, video calls, phone calls, messaging,
and
however you feel
demand.
the most comfortable. You'll be matched with somebody usually within 48 hours, so you can get started fast for those issues that really just can't wait. So thank you to our sponsor, BetterHelp. Let them connect you to a therapist who could support you, all from the comfort of your own home. Visit betterhelp.com/motherup and enjoy a discount of 10% off of your first month on us. Okay, so have you seen the guy with the sign on Instagram?
Yes.
Who always has these controversial things that people are talking about, or cultural things that people are talking about? Well, we have a doctor on today. He's a pediatrician who is the pediatrician guy with the sign. His Instagram is so good, so informative, and in the best way of how you want to get information, short, concise, and pretty funny too.
No BS.
Yeah, snarky, which we're big on the snark and sarcasm here at Mother Up. He just has these signs of what you need to know. And I was scrolling the other day, and this one really got me, because I've been in this phase where Sienna wants to do everything herself. She's 3 years old. She wants to assert her independence, and it just takes too long. And I just don't have the time for that. I don't have the patience for that. And I find myself getting so stressed about it. And he had this sign that said, bring your kids. It may take longer. It may slow you down, but maybe that's the point.
Right.
And it stopped me in my tracks of oh, okay.
Because we are slaves to the clock, and slaves to a schedule, and slaves to time, and where we have to be and what we have to do and how fast can we get there. And
yes,
all of the things that we just need to take a deep breath.
Yes.
And release.
So while he is a pediatrician and knows so much about the science of our kids and their health and their well-being, he just gets it too, as that sign and that post showed. So I'm excited to have him here today. Dr. Joel Warsh, also a little product of Philadelphia, as Casey and I both are, coming out of the Thomas Jefferson University Medical School, but now in the 90210 Beverly Hills. Thank you so much for being here today. You have a nickname that people also call you. Tell us what that is.
It's Dr. Gator, and it's from my wife's last name. Her last name's Intelligator, so everybody thinks it's a Florida thing. It's not a Florida thing, nothing against Florida, but I grew up in Toronto, went to school in Philly, moved to LA.
You're not from the swamp.
Yeah. No Florida connection, just a Gator connection, I guess. I don't know, but that's a wife thing.
So do the kids love it though? All the kids probably love calling you Dr. Gator?
Yeah, they do. A lot of times kids will come in with alligator shirts or things like that. So it's cute. I mean, I like it. I think it's funny. So I'm totally fine. And I kept it because I think the kids like it. So it works for me.
It's very kid friendly. Okay. Tell everybody your credentials, your background. Give us your resume so everyone knows. For all the doubters out
You're
there,
the real deal.
You're not just a pretty smart face on Instagram with a whiteboard.
Yeah, definitely not, the smart face. I think that, look, at least going back for me, I did all the regular medical training, like you said. I trained at Thomas Jefferson, then I did my residency in pediatrics at Children's Hospital of Los Angeles. But I did get a little bit frustrated with the regular system and, the really short visits for everything, medications for everything all the time. And so that's what led me to start learning about integrative medicine and natural medicine. And, certainly integrative medicine can be woo woo at times, or people think that it's woo woo at times, but it's really not. It's really just blending the best of modern medicine with natural and alternative remedies, and that's what I try to do. And as I've seen that interest grow in that, I really have kind of migrated even into integrative parenting, kind of bringing things together, balanced perspectives. Everything seems to be so divisive these days. Everything seems to be like, you got to do it this way. This is what the guru says. Anything else that you do is the wrong way. And whatever you're doing, if you don't do this, it's so bad for your kid and you're going to have all these problems, which is not true. There's so many ways to do almost everything. And that's what, really I've been trying to speak to on social media. But even as you said on social media, it's still small kind of bites here or there. And so that's even what led me to write the book, is try to get into some of these things a little bit more and dive a little bit deeper into the science, but also really just to kind of talk about the different questions, the big questions that parents have today, and talk about the different sides and how you make a decision that's right for your family. Because it's pretty rare that there's only one way to do something.
Well, that's what we've talked about on here before, are that, social media clips are just that. They're a clip, they're a snippet. And if you don't explain it ad nauseum in the caption, people are coming for your head, and people usually don't read the caption anyway. So I'm sure people try to cancel you constantly online. I have a question. I don't know how to word this, but are you an anti-vaxxer?
I'm not an anti-vaxxer. So I am very pro parents being able to make decisions for themselves. So I think that,
which is not popular in California.
It's not popular anywhere in medicine. But
well, going back to Gator, it is more popular in Florida than it is in California, for sure.
Sure, definitely. I think they're a little bit more, in certain states and certain places, a little bit more open to freedom of choice. But I guess for me, one of the biggest frustrations in medicine these days is it's a lot more about telling people what to do. So it's like, do this, this is my way, this is what I believe, this is what you should do. But even the word doctor comes from docere, which means to teach in Latin. So that's like the actual literal definition of the word. But teaching is kind of moving out of medicine, and telling has become more of the way that things are. And to me, that's very frustrating, because I don't feel like it's my job to tell people what to do. I feel like it's my job as a parent, pediatrician, wellness advocate to inform people of the information that is out there to help them make the best decision that's for them. That might be the same thing that I think. I think if you have a good doctor that you trust, hopefully most of the time you're going to agree on what to do. But it's not about me saying like, oh, you should do this, you should go get your shots. It's here's the evidence behind it, here's the pros and the cons, and make the decision that's best for you. And unfortunately these days it seems like we've moved a little bit more to like, again, like the division, like you're on this side of the question, you're on that side of the question.
Or that. Do you believe personally in a delayed vax schedule?
I mean, I guess it kind of depends on the question, because I don't know that to me, I would word it that way. I would say that I don't force people to do anything personally. So I think that we have discussions around shots, and then people make their decisions based on whatever makes the most sense for them. Some people do delayed schedule. Some people choose to do other things. The only thing you can technically recommend as a doctor is a regular schedule, because that's what's been studied. Nothing else has really been studied. Right. I wish there was a lot more research.
Well, for example, I have two friends who are neurologists, and I was speaking to them. They have children a little bit older than Gianna's and mine. And they were saying, for example, and I'm not remembering this correctly, but there's one round of recommended shots where they're given 3 active vaccines. Does that make sense? And they said those, I think it's like MMR and maybe 2 others. And they said that's the place where you can space those out instead of, jabbing in 3 active. Is that the correct terminology?
So there are, when you go in at each age range, there's usually a couple of different shots that are recommended on the regular schedule. So it might be 2 or 3 or 4, depending on your age range. And so some people do decide that they would rather just do 1 at a time, or maybe 2 and come back and do others. So when it comes to doing that, I mean, again, there's a recommended schedule. That's what we can recommend. Certainly I can't recommend anything else here without talking to people or being a doctor. If you have questions, you got to speak to your own physician about these kinds of things. But there are other ways you can do it if you choose. That's just not following the CDC schedule. But it doesn't mean that you still can't get them all done. Just some people decide, I just want to do 1 today. But that's not based on any data or research because it's never been studied. So I can't even say if it's better or worse because it's not what's been studied. What has been proven, theoretically air quotes to be the best is what the CDC says. Now, if there maybe is more research done in the future, maybe something else will be different. But that's not how it is right now.
You have a book coming out that is all about this approach that you take with the balance of science and natural wellness, which personally I love. And I think it makes the most sense and is a reason why I've stayed with my pediatrician, because I felt that she really had that balance as well. Like, for one example, with breastfeeding, which I know can be controversial sometimes, she looked at me and was like, well, what's going on at home? Well, does this work out for your day? Well, what is this? And da, da, da. It wasn't just breastfeeding is best. That's what you should do. No discussion. She kind of looked at an approach of my personal lifestyle, what worked best for me and baby to be able to make a decision. So in your book, can you give us some of just the overall, the way that you go about this approach and how you integrate them together, what people can find when reading your book?
Yeah, I try to go, well, first of all, the first chapter really lays out the holistic perspective, kind of diving into decreasing stress for parents and also talking about the things that lay the foundation. One of the big things that is unique about this book, and one of the big things that I wanted to do with this book, is to get to parents early, because we're seeing this chronic disease epidemic that's coming as we get older. And so I really wanted to get to speaking from day one about all the things that we can do to help with our kids and to make sure that we're healthy. So that's how the book starts, which is very unique to a parenting book, because most of the parenting books are written by therapists these days or moms, and they're not necessarily written by pediatricians. The older books used to be, but the new ones are not. So they're great books by therapists, of course. There's some really great ones, but they just don't have that piece of health. So I do start the book in that way. And then we go through with the rest of the book, the different ages moving up and the big questions that I get consistently in the office, diving into the research that is out there and then synthesizing it through stories, trying to be a little bit humorous so it's fun to read, and then trying to help people think through how to answer the questions for themselves. So maybe like a good example would be starting foods for a baby. So baby-led weaning versus purees. Very hot topic these days on social media or whatever. It's like, you got to do baby-led weaning. That's like the cool thing. And if you don't do that, then you're going to have all sorts of motor issues and this and that. But then I get a lot of parents that come in the office, and I think a lot of people online are very nervous about choking and they don't feel comfortable doing it. So the discussions that I might have with parents are around, well, if you're very nervous feeding your 6-month-old every single day, that's not good for you. That's not good for them.
Right.
There's really no reason you can't do purees. There's really no reason you can't do both. It's not definitive that you have to do one or the other.
Well, now purees have lead and they have arsenic and they have glyphosate. No, it is
lead girl here.
No, but it is exhausting. You see something every single day about organic things are bad and this is bad and that is bad. And I'm going to let you keep going on this tangent, but
we'll talk about
just
that. Yeah.
One stat that I do want to add is nearly half the population does have one chronic disease. So to your point, that is what you're trying to prevent. Like, that is a staggering, and I think 42% have two.
Yeah, no, it's insane, the numbers, and I'll come back to that in 15 seconds. But I just want to finish with saying that, like, this is such a heated debate, and yet there's no reason that it needs to be, because there's no reason that you can't just start with purees and move to baby-led weaning. If you're comfortable doing baby-led weaning, do that. You can do a mixture of both and do some foods where it's soft so you're not worried. And also, I remind parents that there are kids without food in the world. So you're worried about baby-led weaning versus purees. Like, what's the real stress here, right? It's not, your kid's not going to not get into college because they did a puree first. Like, it doesn't actually happen.
Yes.
Right?
Yeah. Well, that is the other thing about social media. Like, Susie's daughter is 4 months old and she's already hawking down a steak. That is definitely. And so what for you, what are your milestones? Like, at what age do you want to start purees? Because then they say, oh, you can't give them rice cereal too early because it ruins their gut lining. But then it's like, well, we got rice cereal because we were fussy and needed more calories to go to sleep during the night. So, like, what are your food milestones? Like, when do you have to get rid of the bottle at bedtime?
Yeah. So for most things, I think it's a range, right? And that where it comes back to doing what makes sense for you, because I don't think that thinking of things as a specific milestone, like I have to do it at this age, is really the right way to go, because that's just the comparison that we're making these days for on social media. We're seeing your friend's kid doing something. So eating, I would say on average, most kids start doing food at 6 months. Getting rid of the bottle somewhere between 1 and 2 years, in general, usually like maybe 15 months or so, but it certainly can be later. You ask.
I'm getting close to that. He still gets a bottle.
but there are kids that do it later. It depends what you're putting in there. It depends on the child, depends on your comfort level. But those things are.
When should you do solids? Like, when is it like, all right, they've got a mouthful of teeth, lady. Like, give the kid a strawberry.
I think most people should start around 6 months just to start working on those oral motor skills. Even if it's just one bite, you're introducing them to other foods, you're introducing them to other nutrients. So I think that is pretty standard in medicine, that 6 months is the kind of age. But if you want to start a little earlier, a little later, I think that's fine. And I get a lot of questions more on like, oh, my child's 7 or 8 months and they're not eating a ton. That's fine. As long as they're drinking plenty of milk, then you're totally fine. There's such a wide range of what is going to work for a kid, but I don't think you need to force them to eat a ton. But I would start to encourage it around that age.
I've heard you have to look at 5 days, not like what are they eating in one day.
Also true. Yeah.
Yeah.
Yeah. In our house, it was very interesting because what worked for Sienna, my 3-year-old, did not
I'm so
work
scared
for
of this.
Yeah, did not work for Asher, my 1-year-old. My daughter took off with baby-led weaning. I mean, never had one puree, never had one pouch. Like, just
she's
was
also
not
you,
interested.
and she's Italian. She wants
She
noodles.
was born a 35-year-old woman. Yes, like she wanted to just get going right out the gate, and I was like, "Oh, great, that worked so well. I'm totally doing baby-led weaning again." And my son was like, "What are you doing? What is that? I'm not touching that. Like, I want, give me soft, give me smooth." And so I think it's a great approach that you have, because it's not always going to be a one size fits all for parents or the kids, as we see. You also mentioned this thing called the SEEDS approach: stress, environment, exercise, diet, and sleep. Can you elaborate a little bit about these pillars and the importance in early childhood?
Definitely. And I want to say, like, just to commend you. I mean, that's the approach that I think parents should take when you're talking about, 2 different kids and things are going to be different, because we just need to be mindful. You said, like, it's not always going to be the same between kids. It's almost never going to be the same between the kids, right? You're going to have one good sleeper and one bad sleeper, and one great eater and one not so great eater. And parenting is just this loop of like figuring out what your kid needs and wants, and then, kind of making those adjustments as you go, because whatever worked perfectly for your first kid isn't necessarily going to work for the second kid. And what works for your cousin doesn't necessarily work for you. It's good to know these things. And that's what I say. It's good to know, right? You need to be aware of what the milestones are. You need to be aware of when an average kid eats, but you don't necessarily have to meet that average for every single milestone. So I think just what you said is such a profound thing, and it's simple, but it actually makes all the difference, because otherwise you're stressed that you're doing something wrong, when in reality, it's just 2 different kids.
Well, of course I did. I still was like, oh my God, is there something wrong with him that he can't take the solids just yet? But yeah, I try to just be like, okay, this is all right. This is all right. So yeah.
Right.
We had a whole other episode about mom guilt. So that's we'll talk about that.
We're switching gears. I do want to switch gears to moms for 1 second. One of your whiteboard signs said 35 is not geriatric. I'm seeing so many things now that if you have children at 35 or older, it's increasing your life expectancy. You're more likely to live into your 90s. So please unpack that for everyone who's like, oh my God, I have to crank out one more kid before I turn 35 or else I'm going to self-destruct.
Yeah, I think that's a great question. And I put that up because a lot of the parents that I see in my office are over 35. So I think that's becoming much more of the norm. I think the average age,
especially in those major cities like LA, New York, Miami. I mean, people are getting married later.
Until later.
They're getting married later. They're getting remarried. They're having kids later. They want to have one more child, whatever it is. But I believe the last I saw was around 30 was average age. Maybe it was 31. But there's
an epidemic of infertility, which we can talk about that in a second.
That's just, I think it's taking longer for parents to get pregnant, to there's more miscarriage, all those kinds of things. So I think that all plays into it getting older. But I think the biggest factor is that people are waiting. Both parents are working, and more people want to feel more stable before having children. But I think that as long as you are aware of the risks, and there certainly are as we get older, that some of the genetic disorders, there's a little bit of an increased risk, but it's not a huge risk. All these things are very small risks anyways to begin with. And so,
like, what is the increased risk of genetic disorder once you pass that 35 threshold?
It's different for every kind of condition. So you're increasing your risk of like trisomy 21 and other genetic.
But how much?
I don't know. I don't know each one. Each one is different, but it's a very, very small percent. So it might be like 1% here. And also that question is also very complicated because it's not just how much it's increased, it's also how old you are. It kind of breaks down for most of these things. Like if you're 30, then
if you're 35 or 45, it's different.
45. So I think the thing to just note is that some of the risks increase a little bit, but then there's also a lot of research coming out that, parents, just like I said, parents are living longer if they have children. I think that it's not something, at least, that we should be very concerned about. I don't think that we should be like, oh, I'm 35, I can't have kids anymore. Absolutely not. I don't think it should be a barrier. It's also just the knowledge that it is a little bit harder to get pregnant as you get older. So it might take a little bit longer, but as long as you're aware of that, and I've definitely done a lot of talks and summits on fertility and infertility, and those numbers, they go up. I mean, they do it. It can take a little bit longer as you get older to conceive, but still, it still happens, right? It's still happening. Like, it might be 6 months to a year as opposed to 3 months to 6 months, but as long as you stick with it, then most people are successful. So I think that's good news. I mean, it's positive. I think we need to be positive about it, in that we shouldn't feel any shame about having kids. If you want to have kids and you're 35 or to 40, or, even older than 40, then it's certainly possible. And just, do some reading on the increased risk. But the good news is now we have so many tests. We have all these prenatal tests, so you can kind of look and see your risks for a lot of these things, which is great that we have that now. So yeah, I think that we should not stigmatize it. I think it's just good to know that comes from a time from before, where people were not living as long and not having kids.
Yeah, leave the geriatric, leave us alone. Leave us geriatric ladies alone. I mean, I'm going to be 34 soon, so I am flirting with being geriatric.
Yeah, I'm turning 35, so I don't know if I should sign up for a walker or what.
Yeah, we're just going to put you in a home. We're just going to.
Yeah, thank you.
Somewhere.
As far as research goes, is there something in the realm of pediatrics, pregnancy, or for women that are mothers? Is there something that you're really excited about that's come out in recent years, or something that you wish that they would be more research on?
In terms of pregnancy, or in terms of
pregnancy, pediatrics, anything around childhood, child rearing years?
Any breakthroughs or new ways of thinking? Or
I think, there's been a lot of research on the skin to skin contact. I think that's been wonderful to realize how much of a benefit that is to keeping kids with parents in the room after birth. There's a ton of research into that. It's pretty definitive at this point that you would lower your risk for all of the potential maternal complications, and also for the child as well. So they have, lower risk of multiple diseases. Mom has lower risk of maternal depression.
That's
or
insane.
baby blues. So
for the baby sleeping in the room.
For the baby sleeping in the room, being with mom, staying on the chest.
So, but what say you to how much surrogacy is happening nowadays?
So in terms of, I think that there is a lot of surgery that happens, but even still, even if that is going on, then they can still do skin to skin at that time, and then, be passed on. We're just learning how important the microbiome is. We're learning about how important attachment is. All of these things that we never really thought of before, but how much they matter. And again, if you want to talk about another topic that's really interesting, it's like the biome, right? I think that's another one that's just so interesting.
Well, that's a big thing for me. My son just had to do a round of antibiotics, and that worries me. Because now there's stuff coming out about, kids having rounds of antibiotics. He had an ear infection last year and then an ear infection this year that wouldn't go. I was putting the garlic in his ear, dude. Like I was really trying to get rid of this ear infection, and it was not going away. So what do you say to parents after rounds of antibiotics to help the kid's gut? And do you like probiotics every single day for babies?
Yes, great question.
Sure. These are some rapid fire questions. We're getting lots of good ones here. So
listen, we are squirrels, and we both have ADHD, so you just gotta tap dance with us.
I like it. All these really good questions.
We should. I feel like we should change the cover of this podcast to like Casey with a Nerf gun, because it's basically just like boom, 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 boom.
All right. I don't want to read Dr. Joel's book, so how do I get through the entire book in the next?
Yes, literally.
This is great promo for the book. I'm like, get everything in. You're gonna read all of it.
Okay, so with the antibiotics, so number one, another thing that's excellent in terms of the research that we've had these days is there's definitely more information out there about an understanding of the negatives that we can have from antibiotics. So that does not mean that you should be afraid if you need to take it. It doesn't mean that you should never use antibiotics, but it is excellent that we are starting to understand that we shouldn't just give out these things willy-nilly. They're not candy. They have side effects. They affect your microbiome. They affect your gut. They affect your body, and they affect your later health. Even one round of antibiotics in the first 6 months increases your risk of almost every long-term condition as you're getting older. So that's not to mean that if you take an antibiotic, you're going to have eczema or allergies, but it does mean that it increases your risk. So these are good things to know. So that way, if you have an option for something where you don't need to take it, or you can have a discussion about how important something is, then I think that's really important to have. A lot of times parents go to the doctor and there's some sort of concern, and so the doctor thinks that they want antibiotics, so they give them antibiotics even though they don't necessarily need it at that time, like an ear infection, some ear pain. So the really good question to ask the doctor is, do I need to take this? Like, what am I treating? Do I need to take? Because sometimes you do, maybe there's a pneumonia that you're treating, and that's obviously completely reasonable. But if you're taking it for a potential bronchitis, a potential ear infection, but it's most likely viral, then that doctor may very well say, well, you can keep an eye on it for another day or two. Let's see if it gets better. And then if it doesn't, then take this prescription. And the majority of the time it does get better and you don't need to take the prescription. So that I'm excited.
What else do you like for ear infections besides the garlic oil in the ears?
So I like the garlic oil. That's what we usually recommend. So garlic oil in the ears, some pain relief, if need be.
It's like some vampire treatment. I never heard of that before.
It stinks, bro. It's like this yellow, literal garlic oil, and it smells.
So sometimes some like saline sprays in the nose can be helpful too, just to help clear the sinuses. So that way you can get some drainage, or colloidal silver can help too. But the thing with the most evidence is the garlic and mullein drops. That seems to be most helpful in terms of a natural remedy for ear pain. So that was that question. There was a probiotics question. So I don't believe in
giving. Do you have a protocol that you tell parents? It's like, okay, I'm gonna give you the antibiotic, but this is what I need you to do after you're finished.
Not necessarily, because most kids, if you take an antibiotic and things get better, then if it's more if you're doing it all the time, or if you're a very sensitive child, or you're seeing symptoms, you can absolutely take probiotics after or during if you want to. It probably doesn't do any harm and maybe helps a little bit. But I think that you should not be just taking probiotics all the time just because. I'm not a big fan of that. I think that eventually we're going to realize that, we shouldn't just be taking things just because. You want to be eating healthy. You want to have your own gut bacteria, and anything that you're putting in there that's not natural could have some negative side effects. And so I think if you have gut issues, that's reasonable. I think if you're trying to replenish your gut microbiome, that is reasonable. But I don't tell families just to take anything just because. It's usually more.
It's not like an everyday. Like probiotics shouldn't just be like a multivitamin that you take every morning.
I don't think so. I think that.
But can you? Like, will it hurt?
But I don't know, who knows, potentially, right? I think that anything that you're giving your child for a long period of time could have negative consequences. Then maybe there is something in those probiotics that you're taking that you didn't even know was in there, like a toxin or a metal or something in the process that they're making. So you're giving to them for, years or months, and then that builds up. Or maybe we're going to find out in 5 years, oh, this strain of probiotic is not actually that good for you. Or maybe it's not good for your specific child because of their makeup. So again,
what about D? What about vitamin D?
So vitamin D, another one that, is recommended from the American Academy of Pediatrics. But I, again, think that we shouldn't just be giving every kid something just because. You want to get it from the sunlight if you can. It's just that we don't tend to get enough sunlight these days. And there are a lot of people that live in locations that don't get a lot of vitamin D. So
apartments,
it could be
office buildings. Yeah.
Right. So it could be reasonable to supplement. And that's what I'm saying. It's not unreasonable to take probiotics. It's not unreasonable to take vitamin D, not unreasonable to take fish oils or a multivitamin. I mean, these are the things that have a ton of research with very minimal likely side effects. But I don't recommend things just because. I think if you're trying to boost your immune system, if you're going through cold season, if you were just sick, these are all reasonable things. But just to say, oh, for the next year, take all these supplements, that doesn't make sense to me, because you should be getting that from your food.
I want to make sure that we hold some space to talk about autism. What are you seeing these days? Are there rising rates of it? Are there any more explanation for why and how it happens? What are we seeing?
So yeah, it's still rising. Every year, it seems like the numbers get worse and worse and worse. I mean, it was like 1 in 25,000 or so in 1950s, and it dropped to like 1 in 10,000, 1 in 100, then it's in 30, 1 in 36, I think was the most recent that I saw from last year, and then 1 in 22 in California. So it's pretty staggering.
But is that an increase in actual cases, or do you think maybe it just went unreported before? Like, is that a true increase?
Is it more
in actual
diagnosable now?
Yeah.
So that is an extremely controversial pediatric topic. My personal belief is that it is, well, I think it's both. For sure, it's both. I mean, there's no question that we're better at diagnosing, we're more aware. And so there's a chunk of that is certainly from more diagnosis and better diagnosis. But I think that is not even close to the picture. I am very frustrated that people say that that's the picture and that's the reason why the 30, 40.
Medicine has advanced and we have more capabilities to diagnose now. And it's
Yeah,
you're not buying that.
I don't buy that, because 30 to 40% of kids with autism are severe and have, very severe verbal delays and self-harm. And there is no way that we miss that. Like 30% of those kids, where are all those kids with verbal issues? And
What blame do you place on environmental and food consumption?
all of it.
Pesticides.
I think that's almost certainly what it is. I mean, there could be other things.
That's huge. Wait, all of it. That's what you just said.
I think
that's it.
Mostly.
Wow.
Yeah, I think so. I think that it hasn't changed. Our genetics haven't changed that much in 100 years, right? That's not how genetics works. So maybe there's a little bit of change, but not much. What has changed is our environment, right? So whatever it is that we are doing in society, we are doing one or probably many things that are contributing to what we call autism. And so that is creating this significant increase in cases. Now, were there more cases 100 years ago? Probably. But I don't think that would account for 1 in 25,000 to 1 in 22. That's a huge difference. What we are doing in our lives, and the frustrating is we don't know. What's the answers? We absolutely don't know, right? And that should not be the case. We should have so much research going on to be figuring out all the things that are contributing. What are the biggest contributors? Where can we, make changes here or there? And we also have to I think slice up autism as well, because it's not one thing. Autism's a diagnosis based on symptoms, but I think it's caused by many, many things. And absolutely there's the genetic component to it and many other things, but maybe for some kids, it's the food that they're eating. Maybe for some kids, it's the toxins that they're exposed to, or they're drinking water, or, who knows? Like, there's so many things that it probably account for. It's probably all of the things together for most people. And then they just kind of fall over the edge and they have brain inflammation and that's what it is. And to say that it's not environmental, to me, is really, again, frustrating, because there are so many kids that go to.
What can we do? Like, what can people do?
Right. And I was going to say, so a lot of people go to integrative practitioners or autism specialists and they change up their lifestyle. They change up what they're doing. And then some of those kids lose their diagnosis. Some of those symptoms improve. So it's not
heavy metals and parasites are two big factors as well.
Yeah. Heavy metals, parasites, food.
For nonverbal, I should say specifically.
Mm-hmm. Right. Because you have to think about it very basically. We're built of what we eat. And if we're getting crappy food and we're not getting the nutrients that we need, then your body cannot function. If you throw onto that all sorts of chemicals and toxins that we're exposed to every day, all the time, through the air that we breathe, the water that we drink, the food that we eat, on our clothes, in our environments, every single thing has chemicals and toxins, and it's getting more and more and more. Then how do we expect our kids to function? There's no way this wouldn't happen. And that's not autism. That to me is all the chronic conditions. That's what it is. It's just expressed in different ways. And we know this with diabetes, right? We know this with diabetes. There's two kinds of diabetes, right? You have the more genetic one where you can certainly help with lifestyle environment, but it's not the same thing as with type 2 diabetes, where you're not eating the best, you're not living the best lifestyle, you're not moving around. And what happens if you change that? Your diabetes goes away most of the time, or it certainly gets significantly improved. I think most conditions are like that. There's certainly a genetic component, and for some people it's completely genetic, but not for most. Most have a significant environmental component that our genetics affect. So some people are more or less susceptible, but at the end of the day, if we just keep throwing toxins more and more onto our body, then at some point, each adult falls over the edge. But that's what we're seeing. I mean, 1 out of 2 kids have a chronic disease. That's insane. You have 2 kids, one's going to be on a medication. That was not like that a long time ago. It was maybe 5% of kids had a chronic disease. I don't remember autism. I don't remember.
And chronic diseases, can you list some of the less serious ones? Because when you say chronic disease, that sounds
asthma.
Asthma, yeah.
My daughter has asthma, right? She's 3 years old and she's on medication. Like, why?
Yeah, so there's acute disease and chronic disease. Acute disease would be something, short term, like you get sick, you get better. So you get a cold, you get a flu, you get a diarrhea, those kind of things. Versus chronic illness is something that's, chronic. So it's there for a long time, maybe there for your life, or it's something that you're having to deal with on a daily basis for a long period of time. So allergies, asthma, ADHD, mental health conditions, autoimmune conditions, autism would probably be lumped in there for most people. So anything like that, where it's something that you are managing constantly. You're going to see
Daily,
doctors, you're taking medications, you're outside of what you would be considered healthy, and not needing medication. So anything like that is what's considered in that camp. And it's sad that so many kids are having to do that. And that was not the case when we were growing up. It just was not. I mean, there were some, of course there was some, but it's not like it is today where every other kid has a peanut allergy. Every other kid has asthma, for teens, at 18 years old, 50% of teens have a mental health diagnosis. 1/3 of teen girls thinks about suicide. 1/4 have a plan. 1 out of 10 have tried. Like, those are not numbers that existed ever before. And that means that we're doing
scary.
so much wrong. It's really.
Is it all social media or what is it?
Yeah, let's talk about mental health for a little bit. So like causes that you can contribute and COVID, especially in the pandemic and this whole like shutdown of their lives for 2 years. Like, what are you seeing in the aftermath of that?
Yeah, social media, I would say that's one of the biggest factors. I mean, it's in the news all the time now. And I think there is a lot of discussion this year, which is great. I think that we are talking about mental health a lot more, but COVID, I mean, didn't help at all. It did all the opposite things that you'd want to do for mental health. There was already, some fire there, and then we threw gasoline on it, made it way worse. And social media absolutely is really driving a lot of this. There's a lot of comparison, a lot of frustration, a lot going on there for adults that are not really able to handle this, let alone kids and teens that have only lived in the world for so long. And the algorithms are built to make us upset. The algorithms are built to lead to frustration and fighting. And so there's no way that we're not going to see this, because we keep seeing this fear cycle. Like, the news is always, making you afraid of everything. You're always.
I don't watch it anymore. I really don't watch it anymore.
Yeah, so, it's hard.
It's tough. I mean, unless you kind of curate your world back and you go back to a simpler place, I think it's very difficult. And then you compound all of that with the crappy food that we're eating. So you're not getting the nutrients that you need to function, not sleeping as well. And almost nobody gets the exercise that they need. And what is the number one, cure, or I don't say cure, but number one supportive measure for our mental health, for depression? It's exercise. Exercise beats out almost every medication in any study you ever see. It doesn't mean that you might not need a medication in the short term for some sort of severe depression, or that medications can't be helpful. But if you put them side by side, exercise daily improves your mental health better than almost every medication. But yet that's not what we talk about. We talk about take a pill.
We hear for women that are pregnant that it is worse to deal with depression for your baby than it is to be on a medication for that depression for your baby. In terms of kids and teens, can we kind of say the same thing? It's better to be on a medication to just manage it than it is to, say, stick it out and see if you can get over it. Like, does that create longer lasting problems for them in their lifetime than just being on a medication at an early age would?
I think that's a great question. That's very tough to answer, because that is so specific to the person. I think that, to me, when it comes to medications, and this would go for depression medication or almost any medication, it should be a last resort. So it should be something that we do when everything else has been explored. If you truly need it, I think absolutely for some kids, depression medication could save your life. Just like an ADHD medication could be helping a child to function in school where they couldn't. So medication has its place and can be magical for the right child or the right adult. And so I don't think we should stop using those when we need to, but it's this kind of knee-jerk reaction to give it first versus really diving into.
We're such an instantaneous culture now. Everything can just happen. So it's like parents, I think, can be quick to say, I just want the problem solved. So what do we do
with this? Yeah.
Right, exactly. Yeah. And so should we give, is it the right thing to give kids a depression medicine versus sticking it out? Well, for some kids, they're not going to be able to stick it out. So a medication may very well be the right thing.
Right. Some parents might know their child so well and say, I know my kid and I know they are at their breaking point. I am maybe against medication, but I want my child alive.
Right. Exactly. So that's
their best option.
You have to read that situation. And, that's where discussion with them, knowing your kids, speaking to doctors, all those things come in, but that still shouldn't stop you from thinking about the why. And even if you are taking it, okay, well, now that we are on it, well, what else can we do? What else can we think about? What else might
exactly? So, okay, so what are some safeguards you're taking, or what are some things that you tell parents when they come in with a 3-year-old or a 5-year-old or a 7-year-old, when you're like, don't get them a cell phone, don't let them on social media, be the worst parent ever?
So that comes back to the question which we didn't actually answer before, which you asked about the seeds. So
because I'm shooting you with Nerf gun questions.
we can go back to that. So that's a really important question, and one of the things that I always try to talk about the most is getting back to the foundations, because there are so many little things that we can do to make a huge difference in our kids' lives for any of these things that we're talking about. And so I start the book, I talk about the Dr. Gator smoothie, which is kind of making fun of all the gurus out there. They go on the daytime talk shows, they break out their smoothie that cures everything, and that's what there is for health, which realistically there's no
green coffee bean extract, baby. Dr. Oz.
There's so many great things out there, but none of them cures everything, right? That's not how it is. Like, the reality of what is really needed is going back to the basics and thinking about the foundations. So I start with the seeds, which is stress, environment and toxins, exercise, diet, and sleep, throwing in things like sunlight, family, community, love, nature, all these things that actually really matter for our long-term health. And then if you really want to drive down into specifics, I usually try to focus on food and toxins, because that's where you can get the most bang for your buck. That's where you can make the biggest change. And that's where almost everybody is really running into such a big issue these days.
On my lead crusade.
Yeah. Our food at its best is not that good in general.
Yeah.
And, we were kind of joking about the food before we started talking about, where you can get food, but it's like, if you're getting your food from a grocery store, then how good could it possibly be? You go pick a berry off of a plant. How long does it last? Like, 2, 3, maybe 4 or 5 days if you're lucky. But if you're getting something at a store, then half the time it was picked in some other country, shipped across the world, sits in a warehouse, then goes to the store, then sits there for a couple of days, then you pick it up, then you eat it. That's like 2 weeks later or whatever it is. So how could that food not be sprayed in all sorts of chemicals? And that's in the best case scenario. That's what we don't even know. Then if you're going to go in there and you're going to buy prepackaged foods, then there's going to be even more chemicals and toxins there. So what can you do? You can be mindful. You can be a mindful consumer. You can read the labels on everything that you buy. You can try to buy things without labels as much as you can. You can try to cook a little bit more. You can start learning.
One of your white signs was, real food doesn't have ingredients. It is an ingredient.
Yes.
I loved that.
Yeah, definitely. And that's true. I mean, we grew up at a time where, fast is better. Convenience is better. Cheaper is better. And that's,
but to your point,
fine.
We think we're cooking our food and we think we're buying organic and we think we're doing right by our family.
Mm-hmm.
But with the 2-week lead time, you're still not. So
right.
do you just live at farmers markets?
So that's where the biggest frustration is, because the most parents are like, well, what do I do? Right. And so the answer is you do the best that you can, right? You do the best that you can within your budget, and wherever you are today, you try to be more mindful and you try to improve it slightly, because every step in the right direction is better, and these things add up over time. And so if you are, buying everything prepackaged, we'll try to buy a few things that are not as prepackaged. If you're not reading labels, try to read labels. And it doesn't mean you have to go from chips to broccoli for your kids, but you can look at the 2 bags of chips and pick the one with better ingredients, or the words that you actually know what they are. And that's going to get you a little bit farther. Go to farmers markets if you can. Yes, that's great. If they exist in your area, they might not. I mean, not everyone's going to move to the woods and have their own garden. Could you do that? Sure. I have friends that have moved, right? I have friends that moved to the middle of nowhere and live in communities that
Casey would love to.
So, yeah.
As long as there's Amazon and Wi-Fi.
Yeah. So you got to move somewhere that has like a little bit of both. But you can plant a little garden at your home. You can put some things, in your windowsill. For most people, you can go to farmers markets if they exist. You can get to know farmers, and you can order things directly from farms. And not everything costs more. Some things do, but sometimes you can order things directly from the locations that make things, and that's not necessarily going to be more expensive. It might be cheaper because you don't have a middleman or a store.
That's true.
So it can be more. Sometimes it is, absolutely, and that's where you have to balance for yourself what you can afford, because for me personally, I take food so seriously, and I think it's important. We spend a lot of our money on food. We try to buy things at the best possible places, and that does cost more sometimes. But to me, you trade it with your health. So, we make we do make a lot of excuses these days. And that is, like, we don't have the time, we don't have the money. And I get it. Trust me, I get those things. I absolutely do. But if we live the same way that we're living and we don't do anything different than the average, American, Western civilization family, your kids are going to have a chronic disease and you're going to have a chronic disease. That is what the statistics are. So either you do that and you're okay with it, or you decide that you're not okay with it and then you have to do something different. And if you're going to do something different, that means that as much as we have those, air quotes excuses, you have to find a way to make it work within your day, whether that means reworking your budget or trying to find things that you can get within your budget, or trying to build in some more time to cook. And that may not work for everybody. And I talk about things like this and someone says, well, what about the single mom that doesn't have time? Like they, get mad at me. I'm like, yes, I get it. That might not work for every family. It might not work for every parent, but regardless of whether you're a single parent or you have millions of dollars, whatever it is, the same things hold true. If you don't feed your kid healthy food, and you don't cook the food, and you don't know where your food comes from, they're going to get a chronic disease. Those are the statistics. So we can say whatever we want, but at the end of the day, we have to build our lives around health and not convenience, because you lose health with convenience. So we have to just decide to balance that, and you decide what you can do and where you're going to prioritize. And if some people, that just might mean that they buy a few more products, or they cook one more time a week, or whatever that is. And that could be enough for your family.
So how do you counsel parents on being confident in the decisions that they're making for themselves and for their children? Because like you're saying, there's so many different options. There's so many different things
and
to consider.
Everybody loves to tell you how to parent.
Mm-hmm.
Right. And social media, which is like why we're so happy that you exist and we have your social media. Mm-hmm. It's like, hi, I'm just going to make this super simple. Like, this is what you need to know on this topic. But like, how can you help parents feel confident in their ability to parent?
I think the big part of being confident is just taking in as much information as you possibly can in whatever decision you're trying to make, and making the best decision that you feel in your gut for your family, and then continuing to reevaluate that.
No black or white. There can be gray.
There's mm-hmm. a lot of gray, and there's also a lot of, I didn't know this before, but I know it now. So don't feel bad about what you don't know, but just keep learning about these things, because we're aiming in a direction, right? There's no perfect parent. There's no perfect way to do things. And whatever you think is perfect or right, you're going to find out there's arsenic or lead in that thing tomorrow, right? It's like, you talk about rice cereal a few times, you brought up kind of joking.
Don't start with me, Gator.
It's like, that was the normal thing to do, right? That was what everybody did a long time ago. And maybe that wasn't a big problem a long time ago, because maybe there wasn't as much arsenic or issues with the rice that we had back then. But should you be upset that you gave your kid rice cereal 30 years ago? No, I mean, that's what is normal, right? But now we know, okay, maybe that's not the best thing to do, or maybe people are not doing as much. Let's start with something else. But you have to be open to learning about these things and kind of constantly reevaluating things. But you take it in the light of thinking about things in a health conscious way, right? And that is how you have confidence in what you purchase. You're not going to necessarily know every single ingredient that's on your carrot, but if you know that you're going to look at the box and read the ingredients and say, I don't even know what that word is, so I'm not going to buy it, then you're moving in a better direction, and you're making decisions with the best possible information that you have. And if you don't know something, then you go learn about it. But that is how
it's interesting. I've certainly looked at food for myself so much different now that I have kids, because I feel like, sometimes you don't really care about yourself and you're whatever, you care about others differently. And that's really how it is. I've started caring so much about what they're putting into their body. And then I'm like, wait a second, if I'm worried about this for them, like, why am I doing that to myself? So now I do really like kind of scan the labels, like you said, or pick different products than I would have before. How do you see the landscape of pediatric care evolving or changing over the next decade? I mean, I feel like there's so many things that we mentioned now about like new research coming out, or new stats are changing, just even the way that people are approaching food, like we just talked about. What are some of the other things that you think might be the major points that will be like bigger for parents to look at in the next few years?
Even birth options, I think, is like the root of that.
Yes. So I think going bigger, kind of bringing those two thoughts together, because I think they are linked, is I hope that we move to a more integrative space. I think that we have to, because chronic disease is skyrocketing and medicine has no ability to handle that, and it wasn't set up for it. I think that medicine was set up for infectious disease, right? I mean, people were living till 40, back in the day. So it's not
Oh
like
yeah, like
everything
the
we're doing is
fever, the fever took you. Yeah, that was
right.
just
Exactly. So it's not like everything we're doing is bad, right? I mean, we've gotten a lot of good. We're definitely living a lot longer than we used to, but now our life is
How do you
getting
manage
back
that?
down again.
Yeah.
So we have done a lot of good in that world, but now we have new problems and we haven't really adjusted medicine back. And so we have to take all of the good that we've learned. That's why I said modern medicine's not all bad. Medications can be very useful and MRIs are great if you need it and all that stuff. But we also have a chronic disease epidemic and medicine is not very good at that. And the lifestyle choices that we're making are not so great for our health in general. And so we have to swing the pendulum back a little bit and now start to expand out and focus a little bit more about chronic disease and prevention. And I hope that we will see that over the next 10 years, but it's not easy. Medicine's very slow to change.
Quite follow-up question on that. What do you see in your peers? You said doctor means to teach. So what are you seeing with new, let's just focus on pediatricians right now. Pediatricians that are your age in the game now, do you see them progressively thinking, and are they on the same boat as you are?
I think some are. Medicine, again, it's very slow to change. You have to be open-minded if you want to get into the integrative space at all. You have to see it benefit patients, which I think we're seeing it more and more with social media because people see patients going other places and getting better, and then it opens their mind. That's what it did for me. I was not very integrative when I was growing up, but I think that you start to see things. And
you didn't know there was another way. I mean,
right, I didn't know there was another way.
Yeah.
So it has to be kind of shown slowly, but we are seeing things trickle in, like, acupuncture, right? It was woo-woo 20 years ago. And now we have an opioid epidemic and then they need another alternative. So, okay, well, acupuncture works really well for pain. Let's put it in every hospital. So that's not woo-woo anymore. So the things are starting to trickle in to mainstream a little bit, but it does take a lot of time. Certainly the younger generation, a lot more doctors reach out to me and more recently and are more interested in it. So I think it grows. I think it's going to grow with patients, though. It's not going to grow with medicine. Medicine's never going to change like that, I don't think, in the short term. I think it's going to change because patients are going to demand it or require it or ask about it or whatever it may be and kind of push it in. Just like any industry, the industry doesn't usually change because they want to. They change because that's what works. And so, if it's working and there's a demand for it, then it will move that way.
I giggle every time you say woo woo because we talk about the woo woo on this podcast quite often. So you fit here perfectly. I love it. I'm also panicking because we've been talking for 49 minutes and I feel like we have 17 hours more.
I have 6 more questions left that I really do want to get to. So you do yours.
I just wanted to do this pediatrician power round. So some things that I'm sure moms want to know about. I know we always want to talk about. And if you could just give us a very quick summary. Try not to have a zillion follow-up questions, Casey Hosmer. So
I have 6 questions right here that I need to ask. So go ahead.
All right, well, we're doing this power round real quick. Sleep training, good or bad?
That's one of them.
I think it's good. I think that sleep training, most parents enjoy it after they are done it. They generally I've never had any parent come back to me and say that I'm so upset that I did sleep training. They always wish they did it earlier, but I think that you have to go back.
But are you doing irrevocable damage to your child's brain and they're going to feel abandoned?
I don't think so.
Okay.
Next, moving on. Social media. What age should they be allowed?
Nobody should be allowed social media. But if we are allowed
fair point.
That's very fair point.
the older they could be, the better, 16, whatever. But I think at least not on your phone, right? If you're going to be on social media, then, maybe just on your home computer every now and again, if need be. But we have to start pushing it back because it's so bad for everybody.
Giving kids chores.
Oh.
Screen time or screen?
Go ahead, go with the screen time.
Screen time, I think, younger kids, American Academy says no screens before 2 years. That's not reasonable. Everybody has some screens, so I think you minimize it. We don't want to be on screens forever. The average amount of screen time right now is 7 to 9 hours for teens, so that has to come way down. It's what are we missing? So what are we missing?
What's bad for kids, though, for toddlers? What is, like you said, I mean, they're going to watch TV.
What is bad is what they're not doing. So they're not getting outside. They're not playing. They're not interacting. They're not learning. I don't think if you watch a screen for 5 minutes or you're on a plane, that's going to turn your brain to mush. That's part of the world. And I think it's totally fine, especially if it's educational. You can learn from screens. You just don't learn as well as in reality. So I think if you use it as a tool, totally fine by me. But if you are plopping your kids for 6 hours in front of the screen, that's where you're going to run into an issue.
Giving kids chores, is it torture or is it teaching responsibility?
No, I think you want to teach them responsibility. So I think whether you call it chores or you give them responsibility for different things, I think it is, you want to include them in your daily life, whether that's cooking, cleaning. I think you can go back and forth to whether you want to call it chores and be like, all right, this is your thing to do.
What's another name that you like for it?
Oh, just including as the activities that we do as a family. I don't necessarily have a name, but you can do. I think that's okay. I'm not against chores, but I personally, we just like include our. Can you go do this? Could you set the table? Could you? He doesn't have like his own chores. I guess he just does it.
Yeah.
Fevers. When do you need to worry and go to the hospital?
So fevers you have to break down by age, and so the fever phobia comes out of the first couple of months. If you are a newborn, so the first month to 2 months, if you have a fever above 100.4, that is an emergency that you would have to go to the hospital for to get a full checkup, because babies have an immature immune system and they can get sick very fast. So you have to be monitored. After that, it is no longer an emergency anymore in general. It is not the fever that is the emergency. It's the symptoms that go along with the fever in general. So fevers are not a bad thing. It's your body raising your temperature to fight off an infection and to mobilize your immune system to work better. So just because you have a fever, it doesn't mean much. If you have a long fever, like more than 5 days, if it's super high, like above 105, but mostly when I talk to parents about fever, it's okay, what is going on with the fever? I am not worried about a kid with a 104 that's running around and playing as much as I am with a kid with 100 that can't even, speak anymore. Right. Mm-hmm. So it's, are they having trouble breathing? Are they extraordinarily lethargic and are not functioning as they normally do? Are they in severe pain? Like that's what you worry about with a fever. A fever is just an indication of being sick, but it's not something to be fearful of in general, I think.
I don't know what my fever was, but when I was 3, I had a seizure from a fever. And so did my cousin. So I know my mom is like crazy about that. So I think that has been passed on to me. So that's something that I worry about.
A little bit of PTSD on there. And then my last one is same question about fevers, but rashes. When do you need to worry?
Usually you don't need to worry about rashes. Everybody's so worried about rashes, but it's so rare to do. I always find that interesting because, people come to the doctor and they're like, they show you a picture that like, I don't have any idea what it is half the time. It's usually a part of a virus, right? Most of the time. You think about things in categories. There's the chronic conditions like eczema. You have the viral rashes or the bacterial rashes. You have the allergic type rashes. So it's usually the symptoms along with the rash again. So it's usually, are they having an allergic reaction? How sick are they? Usually with a rash, if you're worried, is it blistering? Is it super painful? Is it peeling? Those are the only rashes that in general are dangerous. Everything else is not ideal, but usually not an emergency.
Okay, my turn. What you eat while you're pregnant. I know for the first 20 weeks of my pregnancy, I couldn't keep anything down besides like white stuff and fruit. So how much are you damaging your baby by not eating protein and eating the wrong things?
This is a tough question. I think that, so that's a very good question. I think you want to eat as healthy as you can and as diverse as you can within reason. If you're having those issues, then you got to do what you got to do to, get your calories in. So you do whatever. But I think in general, you want to eat as diverse as you can, as healthy as you can. And that comes back to trying to eat healthy even before you have a child, so your body can detoxify and you have all the nutrients that you need. And as well, you want to eat the nutrients that your baby needs. But many parents have gone through all sorts of interesting food things as they've been pregnant, and their kids turn out just fine. So I don't think you need to be super afraid of it, but you try to eat as diverse and healthy as you can. But that's not different for pregnancy. I think that's true for always. Right. I don't think you should change, right? I think we should be setting up our lifestyle to eat healthy. And if you need to change because of your pregnancy, then so be it. But we should still try to be eating healthy.
I feel like that's the biggest takeaway from this episode is like eat healthy. Cleanest baby formula. I know seed oils are a huge thing. My son was on Similac, which is not the best. And I attribute his eczema and those kind of issues to that. But I've heard of like Holly, Designed by Nature, Bubs Organic, Bobby. Is there a brand that you like if someone's having trouble breastfeeding?
So you mentioned the good ones. So there's the European formulas. I got Hip and Holly, Lebensworth that are like the common European ones. You have the newer ones out there. So there's like the goat milk formulas like Carita. There is Bobby. But all those are fine. They all have their pluses and minuses. It depends on the ingredients that you want in them. They all have seed oils. Every single one has seed oils. They have to, because that's how they're created. So that maybe there'll be other things in the future, but you cannot replace breast milk. You just can't. There are things in breast milk that you just can't exactly mimic in formula, but we do the best we can. And thank God we have formula. And if you need it, you need it. If you want to do formula, that's great. And it will do a great job. But
what's the minimum amount of time to breastfeed, like to get the kids over the hump? Or like if it's like, I'll breastfeed, but like I really don't want to do it for a long time, like a month, is that a good amount of time?
So the research shows that 6 months is the best in terms of health. So you get most of your health benefits for 6 months, but the true answer to that is you go as long as you can, as much as you can. And whatever that is for you is great, because even just from the antibody perspective that you're giving your kid in terms of passing along the things that you're exposed to help protect them, there's a lot of good there that you just can't get from formula. So even if you can do it once a day or twice a day for a few months, then you're giving them a little bit of that good stuff, and that's great. So you just go as long as you can within reason. Some people can't breastfeed, some people choose not to, some people can't do it for work, some people it doesn't work out for whatever reason. That's fine. But I think the correct answer, if there's a correct answer, is encourage you to do it as much as you can, the best that you can, for as long as you can, and that's great for your kid, within reason of your life.
I have 3 more questions, and they could be fast. How crazy are you about the clothing that you put on your child, especially when they're newborn, especially if they have eczema or some kind of skin issue, like putting them in cotton, not getting the dyed t-shirt from Target that says like mommy's best helper, and it's got like all these different colors and a picture of Spider-Man on it that has, these horrible chemicals in it?
I am as vigilant on that as with food. It's
okay, that is important because people don't think about that.
No.
Please tell us about that.
I think that anything you put on your body, your skin's an organ, it goes in. And so especially if you have eczema or skin rashes, you need to be conscious of these things. And you should be conscious of everything that you purchase, right? So it's the same thing for clothes. You need to know, what's the clothes sprayed in? Is there a flame retardant?
Right.
What is the clothes made of?
Which are on car seats and strollers a lot of the times.
Bamboo. And so does that mean you can't use those things? No, it doesn't. But again, those things add up. They go into your skin, they go in your body. It's one more chemical. And if you can decrease the amount of chemicals and it's not more expensive, or it's within your budget, or it's within reason, then why would you not do that? Why would you want more chemicals?
Right.
You want fewer chemicals. We have plenty. We don't need more.
Do perfectly healthy kids need flu shots?
Do perfectly healthy kids need flu shots? I cannot answer that for you. Do they need health? Nobody needs anything. I think it's a question of whether you want to get it and whether you weigh the pros and the cons for yourself in terms of any shots.
Okay, last question. I've seen so much online about the detriment or the damage caused by daycare or by having your child with a nanny. So what are your thoughts on putting kids in daycare?
Ooh, ending with a bomb.
Bomb.
So I think it depends on who's taking care of your child. I think you can have a better experience at a daycare if the daycare person is amazing versus a bad nanny, but one-on-one is always going to be the best if you pick somebody who is great, right? Because you get to have that choice, you get to have them have all that one-on-one attention, and also at daycare you're exposed to a lot of kids that are sick all the time, and you're not necessarily sure all the things that they're feeding them, what are they doing with them all day. So if you have that option, one-on-one care is my preference, I would say, but that doesn't mean that you can't have a great experience at daycare, or it can't be a small little daycare, or the teacher, the person there couldn't be the best.
But are you ruining your child if you put them in the care of whether it's a one-on-one nanny or a
someone
daycare?
Who's not mom?
Yes.
No, I don't think so. I think that, no, you're not ruining them at all. I mean, so many people, we've all gone through having nannies, or most people have nannies, daycare, school. We all go through it at some point.
Right.
You're not ruining them. I think it would only be ruining them if you give them to a bad role model, or someone who's not taking care of them very well, or abusive.
Or the other side of the coin, that they don't know how to be with anybody other than mom. They aren't socialized enough.
Right. So you're getting them socialization. So I think it comes down to who they're with, and having a lot of, there's a lot of research, and it's not specific to nannies, but having other role models outside of the parents is very helpful for you. So if you can have good role models, whether it's daycare teacher, kindergarten, school teacher, nanny, whatever that is, if you find a good one, then I think that's great.
Love it. Wow.
Thank you so much for putting up with us that last hour of just rapid firing questions. I mean, you are a wealth of knowledge. I wish you have a book that's coming out, but can you create an app where I can just put you in my pocket and just be like, Dr. Gator, what is the issue on this? And that would be really successful. I think
we need a Chat GPT version of you.
Yeah, right. Drop your Instagram handle and where people can find the book.
Sure. By the way, funny enough, I'm working with Miri, which is an AI company.
Wow.
And they are working on doing those kinds of things, actually. So
Love that.
Amazing.
Hate,
it here
hate
first.
AI, but love that for us.
how it's going to work, I don't know, but I'm like part of it just because I'm curious, and I think that would be really cool to have like an.
Yeah.
But the problem is with AI, and I will finish with that it's still medical advice, so it's really touchy. Like I think there's a lot of advice that could be really good with AI, like diet information and exercise information and that kind of thing could be super useful for it. So you can kind of get that feedback, but medical information still iffy right now.
Liability. Yeah, that's difficult. But people are moving into the concierge doctor where it's like, I want to be able to text you at 8 p.m. when my baby has a rash on their butt.
Yeah, I get that.
And send you a picture.
Oh, I get a lot of 8 p.m. rash butt pictures. It's fine.
Yeah. While you're eating your dinner, you're like,
Yeah.
Nope, it's fine.
It's all good. But yeah, my Instagram, Dr. Joel Gator. The book is Parenting at Your Child's Pace. You can go to parentingatyourchildspace.com to get the book, or go anywhere where you can get books. But if you get it from the website and you email me, which is on there, then I will send you the first chapter, a bonus chapter, and access to the VIP for a month free, which is like a community where parents can chat, ask questions, talk about natural parenting, and we do all sorts of lives and things like that, so people can kind of follow up with more questions.
Good.
Love that VIP package from Dr. Gator here. Thank you so much for being here. We really appreciate it. Best luck, best wishes, and best of luck to you with the book and to your future and everything that you're doing. So thank you so much.
Thank you.